Please read our disclaimer. Imagine this. You're in a room with two other people. Statistics indicate that 1 in 3 of you is probably dealing with hypertension. That's quite startling, isn't it? What's even more concerning is that this condition often goes unnoticed, earning it the grim moniker, the silent killer. It's a global health problem impacting millions, regardless of age, gender, ethnicity. In this video, we aim to delve deep into the world of hypertension, investigating its origins, its connection with our diet, and how we can better manage it. So brace yourself as we embark on this journey of understanding, managing, and potentially conquering this silent adversary. Stay with us. Did you know that a staggering 1 in 3 adults worldwide is living with high blood pressure? A figure that's as alarming as it is true. High blood pressure, or hypertension as it's medically known, is a global concern that silently impacts the lives of millions. It's a condition that doesn't discriminate, affecting people from all walks of life, regardless of age, gender, or ethnicity. Often, high blood pressure is referred to as the silent killer, a name that's as ominous as it is accurate. You see, hypertension is particularly insidious because it doesn't always make its presence known through noticeable symptoms. In many cases, individuals with high blood pressure might feel perfectly fine, unknowing that a potentially deadly condition is lurking within. It's this silent nature that makes hypertension so dangerous, as it can quietly cause damage to the heart and blood vessels over time, setting the stage for more serious health complications like heart disease and stroke. Yet despite its silent and stealthy nature, high blood pressure is not an invincible foe. Understanding it is the first step in the battle against this silent killer. It's crucial to recognize that high blood pressure isn't an isolated issue, but rather a part of a larger health puzzle. It's intricately linked with our overall health and lifestyle choices, from the food we eat to the stress we experience. So let's take a moment to truly comprehend the magnitude of this issue. Imagine a crowd of 3 people. One of them is living with high blood pressure. Now expand that to your circle of friends, your community, your city. The numbers can be staggering, but they also serve as a powerful reminder. A reminder that high blood pressure is a silent yet widespread adversary. High blood pressure can be a silent but deadly force. But what causes it? Understanding the causes is the next piece of the puzzle, a crucial step in our journey towards managing and potentially overcoming this silent killer. Stay tuned as we dive deeper into the causes of high blood pressure in our next scene. High blood pressure doesn't just happen. There are various factors at play. It's like a puzzle where each piece contributes to the bigger picture. Let's delve into what these pieces are. One of the significant contributors to high blood pressure is genetics. It's like a family heirloom that gets passed down through generations. If your parents or grandparents had high blood pressure, your risk of inheriting it is higher. Age is another piece of the puzzle. As we grow older, our blood vessels become less flexible, making it harder for blood to flow smoothly. This can lead to an increase in blood pressure. Yet, it's not just about the cards we're dealt, but also how we play them. Our lifestyle choices significantly impact our blood pressure. Take obesity, for example. Excess weight puts extra strain on your heart, forcing it to work harder and increasing your blood pressure. Physical inactivity can also lead to high blood pressure. Regular exercise helps make your heart stronger, and a strong heart can pump more blood with less effort. But when we neglect physical activity, our heart has to work overtime, leading to high blood pressure. The choices we make about what we put into our bodies have a significant impact too. Tobacco use can damage your blood vessels, leading to high blood pressure. Excessive alcohol can similarly disrupt the balance, causing your blood pressure to rise. And let's not forget about diet. A diet high in sodium is like a hidden villain in the story of high blood pressure. Sodium makes your body hold on to water, increasing the amount of fluid your heart has to deal with, thus leading to higher blood pressure. Now, it's important to remember that these factors don't work alone. They often team up, making it even harder for your heart to maintain a healthy blood pressure. So we know that our lifestyle choices can significantly influence our blood pressure. But the question remains, how does our diet add to this equation? Food is fuel for our bodies, but if we're not careful, it can also be the trigger for high blood pressure. Think about it. What we eat can have a significant impact on our blood pressure. Foods high in sodium, for instance, are a major culprit. Sodium causes our bodies to retain water, which increases the volume of blood and in turn the pressure in our blood vessels. It's like adding extra cars to a busy highway. Traffic just gets more congested. And then there are those saturated fats. These are typically found in animal products like meat and dairy. Saturated fats raise the level of bad LDL cholesterol in your blood. This cholesterol can accumulate on the walls of your arteries, making them narrower and harder. It's like trying to push water through a narrowed pipe. The pressure just goes up. Speaking of cholesterol, let's not forget about foods high in it. While our bodies need cholesterol to build cells, too much of it can lead to the same problem as saturated fats. It can clog your arteries, raise your blood pressure, and increase your risk of heart disease. However, it's not just about what you shouldn't eat. There are also foods that can help you maintain healthy blood pressure. Foods rich in potassium, for instance, can help your body get rid of sodium and ease pressure on your blood vessels. And foods high in fiber can help lower your risk of high blood pressure. Remember, it's not just about cutting out the bad, but also about adding in the good. A diet rich in fruits, vegetables, whole grains, and lean proteins is a powerful tool in maintaining healthy blood pressure levels. It's not about a quick fix, but a lifestyle change. But it's not all doom and gloom. Did you know that your diet could also be your strongest ally in the fight against high blood pressure? Imagine if the right food choices could help you manage or even lower your blood pressure. Picture a world where we can combat hypertension, not just with pills and prescriptions, but with the power of the plate. Sounds fantastic, doesn't it? But it's not a fantasy. In fact, it's a reality that many are embracing today. The food we consume plays an integral part in our health, particularly in managing high blood pressure. Certain foods, fruits, and vegetables are rich in nutrients that can help control hypertension. It's all about making smart choices and understanding the role of diet in our overall health. Let's talk about a dietary approach that's been proven effective, the DASH diet, or dietary approaches to stop hypertension. This diet emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy products while limiting foods high in saturated fats and sugar. It's not just about taking things out of your diet, but also about adding the good stuff in. Consider nutrients like potassium, for example. This mineral helps your body get rid of sodium, reducing the pressure on your blood vessels. Foods high in potassium include bananas, oranges, sweet potatoes, and spinach. Then there's magnesium, a nutrient that can help lower blood pressure by relaxing the blood vessels. Foods like avocados, legumes, tofu, and dark chocolate are all high in magnesium. And let's not forget fiber. This wonder nutrient can help reduce blood pressure by aiding in weight control and promoting fullness. Whole grains, beans, fruits, and vegetables are all excellent sources of fiber. The power to manage high blood pressure might just be on your plate, hidden in the humble fruits, vegetables, and whole grains we often overlook. It's not about drastic changes, but small, consistent steps towards a healthier lifestyle. It's clear that what we eat can make a big difference. Let's summarize the key points. We've learned a lot today about high blood pressure and the role our diet plays. It's clear that what we choose to fuel our bodies with has a profound impact on our health, particularly when it comes to managing high blood pressure. We've discovered that high blood pressure, often referred to as the silent killer, is a condition that sneaks up on us, often without symptoms. It's a complex condition caused by a variety of factors, including genetics, age, and lifestyle choices, but one of the most significant contributors is our diet. A diet high in sodium, low in fruits and vegetables, abundant in unhealthy fats and sugars, can lead to high blood pressure. Conversely, a diet rich in whole foods, packed with fruits, vegetables, lean proteins, and whole grains, can help manage and even lower high blood pressure. Remember our discussion about the DASH diet? It stands for Dietary Approaches to Stop Hypertension. And it's a diet plan that emphasizes the importance of consuming foods rich in potassium, calcium, and magnesium, but low in sodium. These elements are crucial for managing high blood pressure. Foods like leafy greens, berries, beets, bananas, and fatty fish like salmon are all powerhouse foods that can help lower high blood pressure. It's not just about adding these foods to your diet, but also about reducing the intake of processed foods, which are often high in sodium and unhealthy fats. But let's not forget, it's not just about the food. Regular exercise, maintaining a healthy weight, limiting alcohol, and keeping stress levels under control are also vital components of managing high blood pressure. Remember, every step you take towards a healthier diet is a step towards a healthier you. It's a journey, not a destination. There will be challenges along the way, but remember, each healthy choice you make, each piece of fruit, each vegetable, each whole grain is a victory. Stay strong, stay positive, and keep making those healthy choices. As we conclude our journey through understanding high blood pressure and its management, remember that knowledge is power. The more you know, the more you can do to take control of your health. We've touched on the causes, the role of diet, and how to manage this condition. But remember, it's a journey, and each step you take towards a healthier lifestyle is a victory in itself. If you have high blood pressure or if you're at risk, make sure to talk to your doctor about your diet and lifestyle choices. They can provide more personalized advice and strategies to help you manage your health effectively. We hope this video has been insightful and beneficial to you in your journey. Remember, we're in this journey together. Stay strong, stay positive, and keep making those healthy choices. See you in our next video. And before you go, please like, share, and subscribe for more videos.